Welcome to the first in a series of videos discussing the challenges of treating high-grade glioma. Be sure to visit the website shown on screen to see all the videos and access additional content. In this video, we examine the current landscape in high-grade glioma.
High-grade gliomas are treated with standard of care therapy. Typically, that involves maximal safe resection, followed by concurrent radiation as well as temozolomide chemotherapy. Again, treatments have remained unchanged for a long time. However, there are certain challenges from treating high-grade glioma. High-grade gliomas are largely incurable. Finding effective therapies has been difficult for many reasons.
Yeah, I think that's really the point, is that we don't have great therapies in the long run. We always have small populations of people that respond, and we want to sort of maximize that and get a better response out of larger percentages of patients.
I think recurrence is really the issue. The majority of our patients are going to recur, and when they recur, there is no standard of care therapy.
At recurrence, surgery really serves three functions. The first is in cases where the recurrence is large, removing the tumor helps our patients' quality of life by improving their neurological function. In situations where the recurrence looks small, it's often necessary to secure tissue for tissue diagnosis so we could initiate new treatment in a timely manner or enroll patients in a clinical trial. More recently, we are approaching resection as a method to secure tissue for molecular diagnosis in order to provide new treatment. But if you look at the current landscape, resection is really only performed in about 18% of patients with recurrence. And in my experience, I think that's underutilized.
I think that's an extremely important point because in recurrence, if only 20% are getting biopsies, that's a large majority of patients that aren't getting repeat biopsy. And we know now in the current landscape that the majority of these patients actually may have new mutations. And so having that molecular information is really going to be a game changer for the treatment of recurrent high-grade gliomas.
I couldn't agree more. I think that we need to continue to strive to understand this disease by securing tissues at the time of recurrence and to develop new therapies for our patients.
I think it's really become a precision medicine that patients are going to be getting personalized therapies. And so we need that tissue to help us understand an individual patient which treatment will be best for them.
It is imperative that we continue to work diligently to understand the mechanism of the disease and seek new approaches for those who might benefit.